Hi, this is Dr. A with your medical terminology video over the endocrine system, and we're going to look at pathologies. So we're going to start with the adrenal glands. Addison's disease is a disease of hyposecretion of the adrenocortical hormones. Symptoms will include increased pigmentation, generalized weakness, and weight loss. It's the opposite of Cushing's, and there's usually not enough cortisol secreted, and also maybe not enough of the aldosterone, so your adrenal cortex hormones. Adrenal feminization is the development of female secondary sex characteristics in males. It's often the result of increased estrogen secretion by the adrenal cortex. And so this can be environmental also due to environmental exposures, etc. But testosterone can be converted to estrogen pretty easily using the aromatase enzyme. Adrenal virilism is a development of male secondary sex characteristics in females. It's often a result of increased androgen secretion by the adrenal cortex, so they have an increased amount of testosterone, which would might give them some facial hairs and things on a little bit more male pattern characteristics. Adrenalitis is an inflammation of the adrenal glands. Cushing's syndrome is a set of symptoms that is caused by excessive cortisol levels. It presents with weakness, edema, excessive hair growth, skin discoloration, and osteoporosis. And they usually have excessive cortisol level is the main problem. Pheochromocytoma is an usually benign tumor of the adrenal medulla. It causes excessive secretion of epinephrine. It leads to anxiety, heart palpitation, dyspnea, which is difficulty breathing, and a headache. So let's look at the pancreas. Diabetes mellitus is a chronic disorder of carbohydrate metabolism that results in hyperglycemia and glycosuria, so high blood glucose level in the blood, and then that blood glucose will spill over and show up in the urine. There are two distinct forms. There's insulin-dependent diabetes mellitus, which is also referred to as type 1 diabetes mellitus, and non-insulin-dependent diabetes mellitus, which is often referred to as type 2 diabetes mellitus. So let's look at these two. The insulin-dependent diabetes mellitus, or the type 1, is a pathology in which the pancreas will stop producing insulin. It occurs early in life, so usually during childhood or adolescence, and the patients must take daily insulin injections because they do not make any kind of insulin. And this is due to an autoimmune attack on the cells that make insulin. Then we have non-insulin dependent diabetes mellitus, or type 2 diabetes, and in this one, the pancreas produces either normal to high levels of insulin, but then the cells fail to respond to it because this is more of a lifestyle-driven disease with excess carbohydrate and excess fat intake, and the insulin is basically always too high, so the cells are starting to just ignore it, and the receptors are getting damaged, and they don't bind on insulin, and therefore the glucose will not come into the cells. This generally occurs later in life. The patient can take some oral hypoglycemics to help control the blood sugar, but they may eventually need insulin injections. This can often be controlled by diet. And of all the cases of type 2 diabetes, of all the cases of diabetes, type 2 diabetes is about 90% of the cases, which is lifestyle driven. And type 1 is only about 10% of the cases, and that's an autoimmune process. So we also have diabetic retinopathy. It's damage to the blood vessels of the retina secondary to diabetes mellitus. And insulinoma is a tumor of the islets of Langerhans that causes excessive insulin secretion. And in this case, what you would see bouts of hypoglycemia, of their blood sugar being too low. Ketoacidosis is an excess of acidic ketone bodies. It is a serious complication of diabetes mellitus, especially type 1, where there is no insulin, and if there's no insulin to get the glucose into the cells, it will burn ketones as fuel and cause ketoacidosis. Peripheral neuropathy is a damage to the nerves in the lower legs and hands. It is secondary to diabetes mellitus, having high sugar. Moving on to the parathyroid glands, hyperparathyroidism is a hypersecretion of the parathyroid hormone. It results in high blood calcium levels. And hypoparathyroidism is a hyposecretion of the parathyroid hormone, and it results in low blood calcium levels. Recklinghausen disease is the degeneration of bones due to a hypersecretion of parathyroid hormone, meaning it's going to constantly be pulling the calcium from the bones and put it into the blood, and so that could cause bone degeneration. And then tetany is nerve irritability and painful muscle cramps due to hypocalcemia. So calcium is necessary for muscle contractions in your skeletal muscles and in your heart, and so if you don't have enough calcium, you can have tetany or your muscles kind of lock up. Pituitary gland pathology, acromegaly, is a chronic hypersecretion of growth hormone in adults, and this causes an enlargement of the bones of the head and the extremities, especially like the hands and feet, but also like the nose and ears and the mandible here. And this is in adults, so this is after the growth plate has closed, so it will not make them be taller. Diabetes insipidus, or DI, is a hyposecretion of antidiuretic hormone, and the symptoms include polyuria and polydipsia, which are the same signs and symptoms as diabetes mellitus, the sugar diabetes, but a completely different cause. So this is why testing is important, and this could be due to a damage to the pituitary gland, for example. Dwarfism is a hyposecretion of the growth hormone in children. It causes short stature, so they don't grow enough. This can be treated with growth hormone. Gigantism is a hypersecretion of growth hormone in child or adolescent, and it results in very tall stature. And so, Andre the Giant, if you've ever seen him in acting, this is a photo from Princess Bride, is a good example of a famous giant. And then here's another picture, for example, of gigantism, so how much larger this person is in comparison to normal height people. We also have hyperpituitarism, is a hypersecretion of one or more pituitary hormone. Hypopituitarism is a hyposecretion of one or more pituitary hormones. So hyper is too much, hypo is not enough. Panhypopituitarism is a hyposecretion of all the pituitary hormones. It causes problems with the glands that are controlled by the pituitary gland, and this can be done due to damage to the pituitary gland from head trauma. For the thymus gland, thymitis is an inflammation of the thymus gland, and thymoma is a tumor in the thymus gland. Congenital hypothyroidism is a congenital condition in which a lack of thyroid hormone causes an arrested physical and mental development. So the thyroid hormone is essential for brain development, and if there's just not enough of it, the brain cannot develop properly. Goiter is an enlargement of the thyroid gland. It usually causes it to bulge right here in the neck, and you can usually see it. You can definitely feel it. And Graves' disease is an overactive thyroid. The symptoms will include exophthalmos and goiter, so you can refer back to the signs and symptoms video, but exophthalmos is a protruding of the eyeballs, and then the goiter we just covered is an enlargement of the thyroid gland. Hashimoto's thyroiditis is an autoimmune destruction of the thyroid. It results in a hyposecretion of thyroid hormones, so we have hypothyroid condition here, and it is one of the most common causes of hypothyroidism in the world and in the U.S., and it often goes undiagnosed. Hyperthyroidism is a hypersecretion of thyroid hormones. Graves' disease is a common cause of hyperthyroidism, and then hypothyroidism is a hyposecretion or not enough thyroid hormones, and Hashimoto's thyroiditis is example of hypothyroidism. Myxedema is hyposecretion of the thyroid in an adult, and the symptoms will include swollen facial features, edema, anemia, so not enough blood, and drowsiness. Thyrotoxicosis is a marked hypersecretion of the thyroid gland. The symptoms will include rapid heart rate, tremors, thyromegaly, and weight loss. This can sometimes happen postpartum, and this could also happen with a hyperthyroid condition that is not managed. And then the pathologies for all glands, we have adenocarcinoma is a cancerous tumor in a gland that produces hormones. It can cause hypersecretion pathologies, and so yeah, because the tumor is causing too much of the hormone to be produced. And that wraps it up for all of our pathologies of the endocrine system.